Hello, welcome to my executive presentation by Josh Santella for Class B Law 421. Today we're going to talk about workplace safety under the Occupational Safety and Health Act. So, an introduction to the OSH Act. What is the OSH Act? The OSH Act, or Occupational Safety and Health Act, is the principal federal law requiring private sector employers to keep their workplaces free from hazards that threaten the safety and health of employees. So, where did this come from and who started it? Let's backtrack to the early 1960s, where Representative William A. Steiger worked hard to try and get a bill passed to decrease the amount of deaths and disabling injuries in the workplace. He said that more than 400,000 Americans were killed by work-related accidents and disease, and close to 50 million more suffered disabling injuries on the job. So when was it established? President Nixon, on December 29th in 1970, signed the Occupational Safety and Health Act. Now that the OSH Act is established, who's responsible for it? So, since the OSH Act was signed into law in 1970, three agencies were created to establish, enforce, and carry out standards to establish this law. The Occupational Safety and Health Administration was created on April 28, 1971. They were solely responsible for administering and enforcing the OSH Act. They do this by establishing standards and regulations for safety and health in the private sector workplace. OSHA will conduct inspections when a complaint is filed, a death happens, or imminent danger is likely. Since its establishment in 1971, workplace fatalities have been cut by 60% and occupational injury and illness rates by 40%. The Occupational Safety and Health Review Commission, or OSHRC, was also created on April 28, 1971. The OSHRC is an independent federal agency and is also independent from OSHA, as it acts as an administrative court. So they will receive and review evidence, hold and conduct hearings, and then render decisions from citations and penalties resulting from workplace inspections in order to settle disputes. The National Institute of Occupational Safety and Health, or NIOSH, was created on December 29, 1970, and is responsible for conducting research scientifically and technically to support OSHA in an effort to aid in establishing new standards for safety and health. NIOSH is a part of the Centers for Disease Control and Prevention and is also part of the U.S. Department of Health and Human Services. State plans under OSHA. So, what are state plans? State plans are OSHA-approved workplace safety and health programs operated by individual states or U.S. territories. There are currently 22 states that are OSHA-approved state plans and cover private sector, state, and local government employees. These state plans are monitored by OSHA and must be at least as effective as OSHA in protecting workers and in preventing work-related injuries, illnesses, and deaths. How was compliance determined? OSHA has developed a general industry safety and health program to help employers determine if they are compliant with the law. There are elements of a claim that are established in order to determine if an employer is not compliant. The first is that an applicable standard must exist. The second is that the standard was not complied with. The third is one or more employees were exposed or had access to a hazard. And the fourth is the employer knew or should have known of a hazard. Employers are required to provide a safe workplace and provide their employees with a workplace that does not contain serious hazards and must follow all OSHA safety and health standards. Employers then must continue to find and correct any problems that violate health and safety. OSHA further requires that employers continue to eliminate or reduce hazards by first changing the conditions of the workplace without relying on PPE or personal protective equipment alone. The goal should be for employers to seek out safer materials, chemicals, or elements to use to minimize other risks associated with working in that job. Employers must also inform employees about hazards through training, labels and alarms, color-coded systems, chemical information sheets, and other methods. Employers must also keep accurate records of work-related injuries and illnesses. They are required to perform tests in the workplace, such as air sampling, noise exposure levels, etc. They need to provide medical exams for hearing and other tests required by OSHA. They need to post any OSHA citations, injury and illness data, and the OSHA poster in the workplace where workers can see them. They needed to notify OSHA within 8 hours of workplace incident if there is a death or 3 or more workers go to a hospital. And they must also not discriminate or retaliate against an employee for using their rights under the law. With employers bearing most of the responsibility, there is also some responsibility on the employees as well. They need to report any signs of safety and health issues within the workplace. So, some recent violations to OSHA. Talking about Great White Construction. Um, this roofing company has been investigated 12 times since 2012 for failure to protect their workers from falls and other hazards. Great White Construction is currently at $1.5 million in penalties after observing its employees improperly using fall protection during a recent inspection. An OSHA inspector observed one job site where an employee was missing a fall protection harness and saw a similar result at another job site nearby. Great White has been cited 14 times with 11 willful violations for failing to protect their employees from fall hazards. The company was also cited 3 more times for a repeat violation of employees not wearing eye protection when using dangerous equipment. Currently, they have been issued 22 citations related to improper fall protection, ladder and safety, and eye protection. Ashley Furniture Stores. Ashley Furniture was charged $1.7 million in penalties to settle charges at unsafe conditions at its manufacturing plant in Arcadia, Wisconsin, and it has led to more than 1,000 injuries. The Department of Labor Occupational Safety and Health Administration cited the company for dozens of violations, including disregard for safety standards. One worker lost 3 fingers while operating a woodworking machine. Apparently, Ashley Furniture encouraged their employees to work fast, and they would receive incentives for doing so. Thomas E. Perez is the Department of Labor Secretary and has said that we have been inspecting this plant several times. We have found many violations previously, which they have been fined, and we continue to come back. The fundamental challenge is their culture is not centered around safety, and they need to construct a better one. OSHA put Ashley Furniture in its severe violator enforcement program for failure to fix several issues, including 12 repeated safety violations. Ashley Furniture has stated many times that they deny all of the violations and say it's due to employees not working appropriately with the machines. The main thing is through all of these inspections on the state and federal level, Ashley Furniture has failed to properly protect their employees from the machinery in the plant. Accountability. So what can employees do to help your organization? It is extremely important for workers to submit claims for safety and health violations within an organization, because OSHA visits only a handful of places on its own accord. This will help with enforcement as well as making sure lives are free from potentially dangerous hazards. This may be troubling for some due to fear of retaliation, but it is against the law for an employer to retaliate against a complaint for safety. Employees can also refuse to work in dangerous, imminent situations and walk out, which would constitute a concerted activity under the NLRA, or National Labor Relations Act, and it is a protected right from being fired for doing such an activity. It would be helpful if employees continuously look for ways to improve safety as well and health in the workplace. Suggestions alone for are ways for employees to help employers get better at safety and continue to keep a safe work environment for everyone. Another great way for employees to continue helping an organization is by making sure that they have the appropriate PPE for their job that's asked of them. This is of great importance because safety is number one when it comes to running a business, and not wearing appropriate PPE will allow imminent hazards that have been identified to hurt somebody. Here are a list of my sources that I've used. Thank you for listening to my presentation.